Dr. Shulkin, it's been about a year since you last visited my office. I do appreciate you coming to the state last summer, but I regret to tell you that we have seen very little follow-up on the state of the VA health system in Alaska. So let me tell you where I think we are right now in Alaska, and this is not necessarily through my eyes. This is through the members of the veteran service organizations that have been flooding my office in the past several weeks. Before you and Secretary McDonald came to your jobs, we had a VA system, a healthcare system that worked up in the state. Our vets were seen in a timely fashion. Those that had conditions that couldn't be handled by the VA were seen in the community at fee-based care providers. We had good partnerships with our community health centers and with the Native healthcare system to back up. But the vets who've been coming in, again, over these past couple weeks, and when I've been up home, they're telling me that the current leadership team at the VA took a system that was working well in our state and went about dismantling it. And a couple illustrations here. With regards to the Choice Act that did not require the VA abandon its legacy fee-based programs. VA reads it otherwise and canceled fee-based appointments. These vets were forced to deal with a dysfunctional Tri-West referral system. They still are. Veterans who've been forced to use the Choice Act then discovered that VA didn't pay for their care as they had done previously. And now what we're getting, the letters that I'm getting from vets are saying, my bills are being sent to collection agencies when the VA doesn't pay. We don't have very deep representation with medical specialists, but specialists who were willing to take the choice card are now telling me they don't want to have anything to do with the hassle, nothing at all. So we've got a loss there. We had a great and innovative director at Anchorage VA Healthcare System, not there anymore. That position's still not been filled. There's still no full-time physician at the Wasilla CBOC. The VA is able to find some providers who may consider relocation, but then they pull out after the relocation promises that have been made by the VA recruiters are withdrawn because they never should have been made. And again, we're not seeing VA senior leadership coming and saying, we're willing to work with you. We're going to solve these problems. So the question to you, Dr. Shulkin, is how would you assess? I've given you my assessment and the assessment of so many of the veterans who are coming to my office, but how would you assess the state of the Alaska healthcare system for the VA in my state right now? What needs to be done to restore the access and the quality of care that our veterans had, but they no longer are experiencing?
Okay. Well, you've mentioned a lot, Senator, and so let me try to briefly just tell you how I look at this. I think that you've identified several things. So pre-choice, I think Alaska had a very innovative system that was working well.
Took a long time, but we got there.
No question about that. Choice was implemented and that system was changed. And I think that some of the situation that you're talking about was dated a while ago, where essentially we weren't using fee-based programs. We weren't using the community care programs, and we were only using choice. That situation has now changed in Alaska, where after our visits up there, we are working very closely with the Indian Health Service. We're working with the South Central Foundation. We're working with the DOD facilities there, where I think that you're not seeing some of the problems that had existed before. The choice program still continues to be a challenge, and that's why we have worked closely with Tri-West to actually embed Tri-West employees in with our VA people, and there are 3 embedded Tri-West employees today in the Anchorage facility. It still is somewhat problematic, and that's why we're continuing to ask for a contract modification so that VA can take over the scheduling of those patients, very similar to what you had before, and we're waiting for that contract modification to be approved. So Alaska was a system that frankly was a great model for the country. It went through some tough times. We're trying to get that back. I think that part of what we're trying to do with this new legislation that Senator Tester has taken the lead on, is to bring back the customer service pieces, what you had in Alaska, back to the VA. And we know that we have a lot of work to do.
Well, and I'm sure you can appreciate the frustration of the many veterans who for years had struggled with a system that didn't work. And then through the good work of cooperation and collaboration between IHS, community health centers, we kind of built the system. And we were providing the care that our veterans deserved and expected, and we wanted to be able to provide, and it worked through all that agencies. And then we come in and we've got this top-down approach, and we're starting all over. And your term, somewhat problematic is not what I'm hearing from our veterans. They're saying it is fouled up, it is screwed up, it is a mess. And it's unacceptable. It's unacceptable because we know how to correct it, because we corrected it. And then you come in and you create chaos. So we had asked in the FY16 appropriations bill that a report be submitted on the current status of VA healthcare in Alaska. We're waiting for a status of that report. You suggest that some of the information that I have here is dated. It is not dated, not based on the experience of veterans who are trying to access their health care now, who are getting these bills from collection agencies now. This is not based on some things that were happening a year ago, 6 months ago. So we will have Secretary McDonald here before the committee, and I certainly intend to ask him what corrective actions or plans for corrective actions you have regarding all of these issues that I've outlined. In the interim, it might be helpful, certainly for you all and my staff, to meet to have a more comprehensive conversation about the quality and the access. Because what is happening now is the quality of care, the access to care has been compromised for these Alaskan veterans, and there will be no compromise. There can be no compromise for these earned health care benefits. And again, I think part of the frustration that we have is we have come so far only to see it turned over literally within the course of a couple months. And you cannot pull the rug out from underneath those who have earned these health care benefits, and that's exactly what your system has done. And we thought that the visits to Alaska were going to materialize in some changes that our veterans could see. But I am pressing each and every one of them. I'm saying, you got to be honest with me, because the information that we get from you is the most telling. And what they're telling me is it hasn't been fixed, it hasn't been corrected, and they're not doing enough. There is no compromise on what our veterans have earned. So know that we're going to keep working at it, and it would be great if we could set up some time to sit down on this.
Senator, I just want to mention a few things. First of all, I appreciate where you're coming from. I heard it personally.
I know you did.
In Fairbanks and Anchorage and the Kenai Peninsula, and these were packed houses of people who sang exactly what you're saying. But I just do want to say a couple things that I hope will be helpful. First of all, this was the choice program. This was Congress's program that we are trying to make work, and we understand that it's not working well, and that's why we're working with you, and we look for your support to make the changes that we need to make. But currently, 96% of all appointments are scheduled within 30 days in Alaska. We have 120 outstanding consults, more than 30 days, that are urgent consults. They're all out in the choice program. They're all scheduled, but that's too long, and that's what we're working with Tri-West to fix, to make sure that we can improve that. In terms of putting veterans in line with their own credit, unacceptable. We don't want that happening. We've established a toll-free hotline now that is 1-877-881-7618 that veterans should call if they're being hounded by creditors, so we can intervene on their behalf, because we don't want them put in that position. And I know that is happening for people in Alaska and across the country, and we're gonna help them with that. Thank you.
Okay, well, I look forward to our sit